Hi everyone, welcome all. Today we are discussing about an important topic, clinical diagnosis. Why I said it is an important topic? Patient report to us complaining about a pain or a sensitivity or tooth mobility or any dental related issue. What is the first step we should do? Arriving at a proper diagnosis. The correct treatment depends on correct diagnosis. So what is diagnosis? In brief, we can say that it is the art of distinguishing one disease from the another disease. How do we arrive at a proper diagnosis? After evaluating the subjective symptoms and objective symptoms. So, what are subjective symptoms? Those symptoms reported by the patient. So, what are objective symptoms? Those symptoms that are collected by us from the patient through various tests like vitality test or radiographic test. After doing test, we will get some idea. So that symptoms are called as objective symptoms. So let's start. So what is the first step in clinical diagnosis? After creating a good rapport with the patient, the proper history taking, which includes chief complaint, history of present illness, past medical history, and past dental history. So, coming to chief complaint, it should be reported in the patient own words, that should include what is patient experiencing, in which side the patient is having the problem, and for how long. For example, the patient report to us with a complaint of pain in the lower right side for about past 2 days. After chief complaint, the next step is history of present illness. So we have to describe the symptom the patient is having. So in that, we start with asking about the kind of pain, whether it is sharp, piercing, lacerating type of pain, or is it dull, boring, groaning, excruciating pain. Why we ask this type of questions? Because from that itself, we will start getting some clue towards our diagnosis. If it is a sharp, piercing, lacerating type of pain, it occurs due to the excitation of the A delta fibers and it might be reversible pulpitis. Dull, boring, groaning, excruciating pain. It occurs due to the excitation of the C fibers and it might be irreversible pulpitis. So next we will ask about the location of the pain, whether it's a localized pain or a diffuse pain. In localized pain, the patient will point towards the one tooth, whereas in the diffuse pain, the patient finger will run through the dental arch either in the maxilla or in the mandible. So why the tooth pain is diffuse? Because the proprioceptive fibers are not located in the pulp. The next important question is the duration of the pain, whether it is short and specific, whether it's persistent and lingering, whether it's a spontaneous pain or whether it's a nocturnal pain. Short and specific, that is, the patient complains of pain when exposed to a stimulus. It can be either a cold or a hot or when chewing food, but the pain subside or removal of stimulus within minutes. In persistent and lingering pain, the patient experiences pain when exposed to a stimulus, but it persists from minutes to hours even after the removal of the stimulus. In spontaneous pain, the patient might be sitting in the couch and watching TV, and immediately the patient is experiencing pain without any stimulus. In nocturnal pain, the patient will awake from sleep because of pain. This persistent and lingering pain, spontaneous pain, nocturnal pain, when the patient complains of any of these type of pain, it's a clue to a irreversible pulpitis. So till now we were discussing about the subjective symptoms. Now we are going to discuss about the objective symptoms. The objective symptoms start with the evaluation of hard tissue and the soft tissue. So you should remember about 3 C's: color, consistency, contour. So first coming to the hard tissue evaluation, when evaluating a tooth, you should first check for about any color change, any discoloration. So discoloration doesn't mean that the pulp is necrotic. The discoloration might be also due to the extended staining. So you have to do other tests also to arrive at the proper diagnosis. So for example, if it is a pink tooth, the chances can be internal resorption. So, but you have to do radiographic evaluation and also the vitality test. The second C, that is contour. You have to check for any tooth fracture or a crack line. The third C, consistency. That is to check for, evaluate the caries and the resorption. Coming to the soft tissue evaluation. In soft tissue evaluation, you have to evaluate both the gingiva and the periodontium. In gingiva, you have to first evaluate for the color change. The change in the contour is usually associated with swelling. The change in consistency, if it is soft, fluctuant, spongy, than the normal consistency, it is indicative of any pathological condition. So while evaluating periodontium, it should be done in very good lighting and a very dry condition, because the chances for missing sinus tract is there if the sinus tract is overlapped with saliva. And also the chances of missing interproximal caries is there if there is food impaction in the interproximal region. The second step is the percussion of the tooth. The percussion you should start percussing the tooth with a mild pressure using your fingertip. Then go for the higher intensity using the back of a mouth mirror or any other instrument. Please don't start your percussion test with a high intensity, because mostly our patients come to us with a severe pain, right? So if we start doing with higher intensity, definitely the patient will jump from the dental chair. So please don't start with the high intensity, start with a mild pressure using your fingertip. So what conclusion do you get from this tendon like percussion? If the percussion is positive, it means that there is some periapical changes. So it can either be pulpal or a periodontal. So to rule out that, you have to go for the vitality test too. So if the tenderness on percussion is positive and the tooth is responding normal to the vitality test, then the condition will be periodontal. If there is tenderness on percussion and the pulpal test, the tooth is not responding to any terminal test, then it can be pulpal. The third point is palpation. In palpation, we are evaluating the intensity of the pain and the consistency of the tissue. You also need to evaluate the submandibular lymph node if the patient is complaining about pain in the lower dental arch. So next is the mobility checking. So how you test the mobility? Using the handle of two instruments or using the fingertip. So if there is depressibility and also lateral mobility, that is usually a grade 3, right? Then we won't encourage root canal treatment. The next is a bite test. The bite test is done using tooth slot or frac finder. In that, the patient is asked to bite on the tooth slot or frac finder and release. The patient will complain pain on release of pressure. So after releasing, the patient will complain about pain. Then it will be cracked tooth syndrome. So the other tests are radiographic evaluation and the vitality test. Both this topic is a vast topic and it is also very important too. So I am planning to do a separate vlog on radiographic evaluation and the vitality test. Hope you all got an idea about the clinical diagnosis, right? So don't worry, I will be taking a separate vlog on radiographic and the vitality test too. So see you all soon with my next vlog.